Today, we have the pleasure of interviewing two key people. They've been very busy lately because they're advocating for wound care professionals, our profession. So today we have Lizzie with us too. And Liz, I want you to kick it off.
Hello. Yeah, welcome to the Frank and Lizzie episode. We're here to talk to you with two rock stars of the wound care community. So we have Marcia Nusgart from the Alliance of Wound Care Stakeholders. She is the CEO. And we also have Karen Ravitz, who is the Healthcare Policy Advisor. Welcome, ladies.
Thank
Thank
you.
you so much.
Great to be here.
Well, Marcia, let me start with you. I want you to tell us who you are. Tell us more about the Alliance Wound Care Stakeholders.
Thank you so much, Frank. Well, I got the idea about 21 years ago to be able to form this wonderful association because it occurred to me that there wasn't a unified voice for wound care. And in fact, it wasn't even my idea. I was at the Centers for Medicare and Medicaid Services, and the head of coverage had come to me when we were talking, and I presented a situation to him. And he said, Marcia, that's a great situation. You gave me the solution, but the Society of Vascular Surgeons were here last week, and they had the same situation, but a different solution. So I know you can bring people together for a common cause larger than yourselves. And if you form an organization, that would be very kumbaya because it would be a one-stop shop. We can come to you whenever there's a question on wound care, and you would be able to provide us the answer. So what I did is I put together all the different clinical associations whose members treat patients with chronic wounds, and be able to said to them, gee whiz, what are the issues that are important to you? And that became our mission: coverage, coding, and payment for wound care products, wound care technologies, as well as wound care quality measures and wound care research. So that forms the foundation of what the Alliance does. We do represent all the different clinical associations, as I mentioned to you before, but we also broadened our membership to also include wound care provider groups, wound care researchers, wound care manufacturers, as well as a number of others in this particular area. So we have about 70 different members, within our organization.
And Marcia, that's great. But I do want to highlight something, your mission, to provide evidence-based quality of care and access to products and services for patients with chronic wounds. I mean, advocating, we thank you for all the work that you and your organization have done.
Thank you. Yes, we are an advocacy association. So you hit the nail on the head. So again, the unified voice for wound care community to advocate on policies that create barriers to patients' access or treatments, to care for any of them for patients with chronic wounds. So you're absolutely right.
And I think, I would have to imagine that, yourself and Karen are very busy nowadays. I feel like all over LinkedIn, I've been seeing all kinds of information. I mean, this year I went to the Advanced Wound Care Summit in Boston. I went to the Symposium for Advanced Wound Care in Orlando. I went to I'm at WOCN Next right now in Cleveland. And, all of the clinicians want to do the right thing for their patients. And it seems that there is this huge disconnect between the FDA and CMS and what can we give our patients. It might be cleared by the FDA, but then there's no coverage. I know Frank's been dealing with Lymphedema Act stuff. So, what is going on in terms of what advocacy projects you guys have going on right now or future state? Can you key us in on some stuff?
Sure. So thank you for that. There is a lot going on, quite frankly, and have been for quite a while. So what the Alliance does, and I'm going to take a step back if you don't mind, so that we can explain to your listeners a little bit about how we go about this. So there are regulatory issues that get issued by the Center for Medicare and Medicaid Services in terms of payment for the most part. They have contractors called Medicare Administrative Contractors. They issue local coverage determinations like the cellular and tissue-based products for skin wound one that just was issued. The FDA comes out with regulations also, which we will talk about a little bit more. They came out with one on surgical dressings and antimicrobials. So again, it's sort of reading through the regulations, seeing what they say, or even the coverage policies, getting that out to our membership so that they can understand what's happening, and then provide sort of steps on what can you do about it, right? How do you advocate? How can you be involved? So for example, there was an issue that came up on hyperbaric oxygen where Medicare, CMS, issued a regulation in proposed format for the hospital outpatient department setting, and it looked pretty good. And then when they decided to put it out in final rule format, all of a sudden there was a 40%, actually a little bit more than 40% cut to the rate for hyperbaric oxygen. And we saw that and we thought, wait a minute, how can they do that, right? I mean, proposed rule, you provide comments, there wasn't anything there. We were like, yay, this is great. And then you have this 40% reduction in final rulemaking format. So we ended up contacting CMS. We told them that this was an issue. We thought it was a technical correction that needed to take place. And they started looking into it at that point. That was in November. Okay. The rates were supposed to go into effect in January of 2024. And we got in touch with them. They started doing the work. We started doing some work, hired some folks to do some data crunch. And they saw, in fact, there was a technical correction issue that CMS probably made a mistake. But you can't bank on that, right? So we got together, there was some collaboration with other organizations, contacting CMS, members of Congress, everything else. And fortunately, CMS recognized that it was in fact a technical issue, and they corrected it by the January 1 date. So that's kind of one format, right? Marcia, there were other issues with surgical dressings that you all dealt with the DME Max. So, you can probably get into a little bit more detail on that.
Yeah, and Frank and Lizzie, the way that the Alliance works is that we have different work groups. And really, we rely on our members to bring up a number of different issues that we work on. We have a surgical dressing work group, a hyperbaric oxygen one, blood-derived products, CTPs, the cellular and/or tissue-based products for skin wounds, lymphedema, negative pressure wound therapy, government affairs. So all of these issues that we tackle are really brought up by the members. There were two items in the surgical dressing ones that came up recently. Karen mentioned one. There's an FDA guidance document on addressing surgical dressings with antimicrobials. We led the forefront on this, that we had submit comments on it earlier this year, and it was very technical in this area. But what we wanted to say is that not only we could, but any of them, our members or those that are your listeners, could have provided a comment, to the FDA on this particular issue, because we were really worried that perhaps the FDA would have had something that in a final rule that could have made these products, such as those containing any of the antimicrobials, not available for clinicians to be able to use. So we were at the forefront to provide comments. Similarly, some of our members had told us there were some claims processing problems with some of the surgical dressings. So what was wonderful is that we submitted our inquiry to the Durable Medical Equipment Medicare Administrative Contractors, who we had a meeting with them. They understood our issues, and then they updated the surgical dressing policy article to reflect, how your listeners would be able to ensure that they were going to be billing for surgical dressings appropriately. So those are just two examples, in the surgical dressing side of things.
Well, and then there was also negative pressure where, again, CMS put forward a way there was everything had to have a benefit category, but disposable negative pressure, there wasn't really a benefit category for it. So Congress created one. And then, Congress created a category, but then what happens is the CMS, the regulatory agencies, have to implement those things, right? And so once CMS implemented the ability for disposable negative pressure wound therapy to be provided, they provided it in the home care setting, which was fine, but then the payment component was out of the hospital outpatient department. And so what ended up happening was there's this big paperwork barrier, there was a disconnect, it wasn't really standardized, and it made it really difficult for home health agencies to provide disposable negative pressure to their patients, because again, the payment was weird, the billing was weird. What are you billing for? How are you doing this to get the nursing time, et cetera? And so there was some lobbying efforts that took place on the Hill. We were supportive of those efforts. And Congress passed the Better Wound Care at Home Act, which had some ability to change sort of the processing of how disposable negative pressure was provided and then billed for in the home health agency setting. And it's helped to eliminate some of those barriers so that it could have easier access for patients in the home care setting to receive the disposable negative pressure. So that was, again, another area where, our members brought that to our attention. The Better Wound Care at Home Act had already been introduced. So the Alliance provided support in that area where we were sending letters to members of Congress to support that initiative. And then when the regulations came out, we were able to provide some additional feedback there. And then there were some additional issues with lymphedema that I know, Frank, you were talking about just a moment ago. So, Marcia, why don't you highlight some of those areas?
Frank, you and I could probably talk for hours on the whole lymphedema, issue.
No, we can. We can, but I want to highlight something because I've been dying to say this. You guys are the two best people to advocate for us because you guys are not stranger to this. Because I remember, Karen, you had something to do with the American Physical Therapy Association a long time ago, getting electrical stimulation covered for pressure injuries, and you were involved with the Government Affairs Board for NPIAP. So you guys have a lot of knowledge.
Yes, we've been around. We've been around the block.
Secrets out.
Secrets out. Secrets out.
Yeah.
So in terms of with the lymphedema, we're still waiting for CMS to be able to get it right. They already told us when. What was wonderful is, and kudos to the patient organization, that was wonderful to be able to have their members advocate to Congress to be able to get this law passed, but then it was up to CMS to be able to implement it. And last year, they put different regulations or proposed rules about this in the home health proposed rule. And with a number of different codes, a number of different ways to be able to implement it. And it still wasn't quite right. We were still advocating for many of the providers to have CPT codes to be able to have the coding and the payment for them to be able to use these products. And we're still waiting for, we asked CMS a number of different questions, working with the American Physical Therapy Association and AOTA, on this particular issue, and we're still waiting for some answers for CMS. So while at least, that clinicians will be able to provide a number of the compression stockings and a number of other compression items for patients, we still want to be able to make sure that the clinicians will be able to get, paid for this for what they're doing right now. So that's always to be continued.
The payments kind of an important piece to that, I would think.
Of course, it's very, very important. But CMS had said this was a big issue, and they knew that it was going to take some time to be able to get it right. So that's what we do. I mean, Karen and I are very patient people. We realize that this particular process, it doesn't always happen right the very first time, but we're persistent. We keep coming back to the agencies and say, I think you forgot this, or you may want to improve on that. And luckily, they listen to us and they try to move forward to be able to correct some of the things that need to be corrected in this area. So,
well, that's so true. And that's even happened with the local coverage policies on CTPs, where, they've been putting out, proposed policies for the past couple years at the local level for the Medicare administrative contractors. And, it keeps going back and forth from getting a little bit better to getting really worse to getting a little bit better to getting. And the very last version that they put out, of course, there was no off ramp. They did a 4 application limitation over 12 weeks. You couldn't do anything about it. Too bad, so sad. Even if you were having wound healing progression after 4 applications in 12 weeks, you were done. And it's like, what are you with that? In what part of medicine does that happen? Right? It just doesn't. So, we did a call to action, and at least we were able to get that one withdrawn, thankfully. But yay, that was a huge success. But they did put out another one, as we all know, and that comment period just ended this past Saturday on June 8th. It remains to be seen what's going to happen with that one. They have, so just sort of a process issue for everybody. There is something prescribed in the program integrity manual that basically says that when the local coverage determinations or the proposals come out through the Medicare administrative contractors and the comment period is over, and it is now over, the MACs have up to a year to implement that policy, up to a year. If they do not do anything with that policy within a year, it goes away and they have to start all over. Okay. Now, we don't believe that's what's going to happen. They're going to put something out on this one. However, we don't know the time frame, but they do have up to a year to put out a final policy. And once that policy is put out in final, according to the program integrity manual, they have 45 days to implement it unless CMS grants them a waiver and it can then extend when that policy can be implemented. So we don't know when it's going to be implemented yet. We know they have 365 days before they have to retire whatever they put out. That's not likely going to happen. They'll review the comments that were submitted, and they did receive a lot of comments on this. And
I've seen some. I've seen some all over LinkedIn. Yeah.
all over the place. And again, we'll see what they do, but they do, when they issue it in final, whenever that's going to happen, they do need to respond to the comments. So there will be a response to comments. So you'll understand why they accepted something or why they didn't. And that's usually very helpful moving forward. But again, from when they issue the final policy, whenever that will be, they have 45 days. So on day 46, that policy is implemented unless they get some waiver from Medicare to extend the implementation date. So
there was a great opportunity, and I'm hoping that some of your viewers did participate in submitting comments on our website. Last year, we had a very robust call to action because we were asking for the policy to be rescinded. This time we said one needs to be able to submit, thoughtful, evidence-based comments in this area. So we did provide on our website, I believe it's still on there, all of the different LCDs and local coverage articles on there to be able to, submit comments. And I have to give the MAC medical directors credit. There were, how many, Karen? 7 listening sessions. There were, each MAC had a separate listening session. So at SAWC, we provided to our members, there were 4 listening sessions at the same time on that Thursday afternoon. What was it, May 16th? And so we had 3 different computers going, and depending on when Karen and I were speaking, we were like, you're number 14, you're number 50, go to that computer, go to that computer. I felt like the 3 Stooges. To make sure that we would have our time to be able to speak. And we had a number of our members, at rounding the computers, and listening to these particular sessions. But they did that. And we also were very grateful that we had Dr. Anitra Graves, the First Coast Medical Director, speak at our meeting. And she gave a fabulous presentations to educate, our members about the LCD process and how they created, how it's not the same anymore because they need to adhere to 21st century cures. And again, we had about 50 questions to be able to ask her. We asked all of our members, tell us what questions you have. And Karen did a phenomenal job of asking Dr. Graves a number of the different questions. And then we had another medical director reach out to us because he and the MAC wanted to have a little bit more information because they realized that on these listening sessions, they didn't always give you enough time. They may have given you 7 minutes, 10 minutes on things, and they wanted to hear more about what we had to say. So they reached out to us to be able to have a dialogue, just like we're having right now, about the policy and what was good about it, what needed to be changed, rationale for having it changed. And it was great to have a dialogue that way.
And I just want everybody to understand that those policies are coverage. There's also payment issues. And, the Medicare physician fee schedule, the hospital outpatient prospective payment system, they're all coming out probably by the end of June, beginning of July, and that's payment. And there is likely going to be some wound care related issues, including CTPs contained in those. So
Yeah.
stay tuned. There's still more coming on the horizon in this space. And, you know, there's other issues that we're tackling as well, but I'll just leave it at that, you know, CMS is coming out with some payment issues the end of June, beginning of July.
So
Well-
perhaps when that happens, we might be able to come back on, get an invitation to say, all right, this is time for you to be able to go back to our website. Here's where you need to be able to submit comments. So,
Well, Marcia and Karen, I want to tell you that Lizzie and I advocate. That's why we're both on the Save a Leg, Save a Life Foundation, so we can help. But I know I'm speaking for myself, but also I'm sure for Lizzie, that it breaks her heart when we can't take care of that patient and it ends up negative. So,
Yeah.
so
Well,
thank
we
you.
would love to invite you guys to come back and give updates as regularly as you possibly can. I think it's good for our viewers to get bite-sized bits of what's happening. And then certainly we'll include information where they can go to your website on how they can become more involved, or they might already be part of an organization that is part
Sure.
of the alliance and they can partner, you know, there's strength in numbers. So I think we really need to utilize that as well. So thank you on behalf of the Frank and Lizzie show for joining us and for offering an update, speaking to those elephants in the room that we've had, and hopefully we'll hear more from you in the near future.
our pleasure.
Thank you.
Thank you.
Thank you.